Roughly half of people who have a heart attack had cholesterol numbers their doctors called normal. Was that you? So does that mean cholesterol doesn't matter? No. And anyone who tells you that is selling you something, okay? What it actually means is that the standard cholesterol panel is missing two things that could be quietly raising your risk right now. Let me show you what they are. Let's start with that number because it gets thrown around a lot, right? And it gets missed a lot. Large hospital data has found that a huge chunk of people admitted for heart attack, in close to half, right? The numbers out there had LDL cholesterols under 100, okay, which guidelines call acceptable or even optimal, okay? So that tells you that we're missing something. If it's not just about cholesterol, right? Cholesterol is an important piece of plaque, but it's not just about cholesterol, okay? If half of the people or around that number have normal LDL, then we're missing a big portion of what also contributes to heart disease and heart attack here in America. Okay. And what that piece, that missing piece is we get so focused on cholesterol, right? Oh, your LDL is high. You need a statin because you could have an MI. Well, all the time over here, we're doing nothing about the growing insulin resistance. Oh, your A1C is 5.5. You're not diabetic yet. Come back next year. No one's checking a fasting insulin, right? That can show us for decades that the body is working harder and potentially we are gonna can turn diabetic a decade before your glucose changes, your fasting insulin can change. But we're not looking at that. We're saying come back later. Okay. We're missing the boat over here. Okay. That piece I want to say that's missing is inflammation, right? Inflammation plays a huge role in arteriosclerosis. The plaque that builds in your arteries isn't just cholesterol sludge, right? It's active inflammatory process in the arterial wall. And if we're not looking for inflammation, if we're only looking for cholesterol, we are missing 50% of the people. Okay. And guess what? Measuring inflammation is simple. High sensitivity CRP, homocysteine. Okay. We can see this. We can measure this. We can do something about it. But yet we are just so focused on the LDL. Okay. We're just so focused on the LDL. And there's studies that looked at, took people who already had heart attacks and had elevated inflammation and gave them medicines to lower inflammation, right? And they didn't even touch the cholesterol. And cardiovascular risk went down. Why? Because lowering inflammation is independent of cholesterol, right? Both are important. But if we're only focused on one, we're missing the group of the other. And it's also proof that the body doesn't work in isolation, right? That we really need to be looking at ourselves as a whole person, not just, oh, your cholesterol's high. Here's this drug. Here's this. Here's this. No, do you have inflammation? How is your liver functioning? What is everything looking like? Okay. And if you have inflammation, what do we do about it? Okay. Yes. What is your genetic testing? What is your lipoprotein little a, which is your genetic risk for having hyperlipidemia, high cholesterol? What is your ApoB? Of those LDL particles that you have, are they small and dense? Right? Are they big, fluffy marshmallows? Okay. These are big deals because a lot of times we're also not changing anything anyone does. If we say, oh, your LDL is high, your cholesterol is high, we're going to put you on a medication. So many people go out and they're never addressing their insulin resistance. They're never addressing their inflammation. They're not working out and they're not moving their body and they're not worrying about what they put in because their cholesterol is controlled by a medication. And you're still at an increased risk for cardiovascular disease. Okay. You're still at an increased risk to die from a heart attack. So the moral of this story is we stop looking at one number and we look at the whole picture. Inflammation is a huge part of cardiovascular disease. So, do you know, have you had a high sensitivity CRP check? Do you know what your lipoprotein little a is? Do you know what your ApoB is? Do you know what your homocysteine is? And if you don't, you should go find out because it's more, much more than just LDL. Okay? So your goal for the week is to go find out. And if you are inflamed, to work on inflammation and to tell your doctor or your provider, hey, I want to look at my whole health. I want to look at this entire picture. Help me do that. Until next time, stay well.